day everyone. Today's session is about the other techniques that are used to measure the prenatal period. The learning objective of this session is to know about different prenatal assessment techniques for identification of problems, issues and defects during prenatal development. To know the functioning of the prenatal assessment techniques, to understand the implication of different prenatal assessment techniques. The session outcomes are students would have understood about different prenatal assessment techniques for identification of problems, issues and defects during prenatal development. They also understood the functioning of the prenatal assessment techniques and the implication of different prenatal assessment techniques. Next type of prenatal assessment technique is the pre-implantation genetic diagnosis. It can identify some genetic defects in embryos of 4 to 8 cells which were conceived by in vitro fertilization, that is IVF, and have not yet been implanted in the mother's uterus. Defective embryos are not implanted. Some parents see their baby for first time in a method called sonogram, or it is also called as an ultrasound scanning. A picture of the uterus, fetus and placenta created by an ultrasound directed into the mother's abdomen. Ultrasound is used to measure fetal growth, to judge gestational age and to detect multiple pregnancies, also to evaluate uterine abnormalities, to detect major structural abnormalities in the fetus, and also to determine the sex of the baby. New ultrasound test measures the nose bone of the fetus, can improve early detection of Down syndrome and avoid the need for amniocentesis, which has a small risk of miscarriage. Both amniocentesis and ultrasound can reveal the sex of the fetus, which may help in diagnosing sex-linked disorders. One more important technique is the umbilical cord sampling, that is also considered as a fetal blood sampling. Here in this method, by inserting a needle into a tiny blood vessels of the umbilical cord under the guidance of ultrasound, doctors can take samples of fetus's blood. This procedure can test for infection, anemia, heart failure and certain metabolic disorders and immune deficiencies. One more important technique is the blood sample. A blood sample taken from the mother between the 16th and the 18th weeks of pregnancy. A pregnancy can be tested for the amount of alpha fetoprotein AFP it contains. This maternal blood test is appropriate for women at risk of bearing children with defects in the formation of the brain or spinal cord, such as anencephaly or spina bifida, which may be detected by high AFP levels. To confirm or refute the presence of suspected conditions, ultrasound or amniocentesis or both may be performed. Blood tests of samples taken between the 15th and the 20th weeks of gestation can predict about 60% of cases of Down syndrome. This blood test is particularly important for women under 35 who bear 80% of all Down syndrome babies, but usually are not targeted to receive amniocentesis because their individual risk is lower. The discovery that fetal cells that leak into the mother's blood early in pregnancy can be isolated and analyzed. To summarize this session, pre-implantation genetic diagnosis identifies some genetic defects in embryos of 4 to 8 cells which were conceived by in vitro fertilization. Umbilical cord sampling can test for infection, anemia, heart failure, and certain metabolic disorders and immune deficiencies. Blood test samples taken between 15th and the 20th weeks of gestation can predict about 60% of cases of Down syndrome. Ultrasound is used to detect major structural abnormalities in the fetus and to determine the sex also. Thank you.